Women will talk about their sense of isolation, which is a big piece of postpartum depression, the sense that no one really understands what I'm going through, that feeling of loneliness. They'll talk about that as really, I'm all alone. I'm all alone and no one understands what I'm going through. I can't talk to anybody about it. Nobody really knows. To describe their guilt, their diminished sense of self-esteem, women will talk about feeling as though they're a failure as a mom, a failure as a wife, a failure as a partner. And in many cases, they'll talk about the fact that they feel that their families will actually be better off without them, or better off with another mother. And you know, I can remember many years ago a woman who came to me for treatment of very severe postpartum depression with obsessive-compulsive features. And I asked her what she felt would be helpful to her in terms of support, more support. And she, very straight-faced, very seriously, said to me, well, you know what I really need? I really need somebody to come in and take care of the baby so that I can go about doing the household chores. And what I think she was really saying to me was, I don't know how to be a mom. I have no idea how to do this. I'm scared, I'm frightened. So let's bring in a surrogate mother, and I'll go about doing the things that are familiar, the things that I know how to do. Laundry, cooking, organizing the household. Because, you know, we know that all of us here, all of us out there, have ideas in our heads about what it means to be a good mom, right? If I were to ask you, what would you say? What's a good mom? What's a good mom? Well, the first word that comes to my head is good mom is available. Okay? And probably in my lexicon, sometimes overly available.
Always
so,
happy.
Always happy.
Selfless.
Selfless, right? Self-sacrificing, right?
Always happy.
Always happy. Listen to that. Always happy. Always happy. Right. What else? What's a good mother? Calm. Always calm. Right. Right. Have you met a mom, Denise, who's always calm?
I keep telling my kids that.
Right. But then what happens when we're not always happy or when we're not always calm? What do we end up doing? We end up saying, oh, there must be something wrong with me. Because the culture tells us what? Right? The fantasies of our culture say moms are supposed to be always calm. Moms are supposed to be always happy. It doesn't matter if you're sad. It doesn't matter if you're grieving inside. Don't you dare show that to your children, okay? Because then you won't be a happy mom, right? What else is a good mom?
Organized.
Organized. Oh my goodness me, I guess I must be a lousy mom. What else?
Reliable.
Reliable, yeah. Responsive, reliable, always attuned, right? Always attuned. And if she's not, right? So we see where these constructs of the perfect mother come from. And yet who is the perfect, do you know anybody who's the perfect mother? As a matter of fact, I think I was reading an article the other day that said none of us are perfect mothers. Okay, well, that's either the bad news or it's a tremendous relief, right? That none of us are the perfect mothers. Women will talk about their hopelessness. They'll talk about it in terms of, I will never be myself again. I'll never be myself again. And I've actually had women sitting across from me in session begging me, pleading with me to promise them that they'll be okay, that they're going to get better. Because the despair and the fear, the terror is so unbearable. Women will talk about the despair as I'm losing it. Okay? So you can see that all of these symptoms, okay, have words attached. All of these symptoms, despair, guilt, diminished self-esteem, hopelessness, helplessness, powerlessness, all those symptoms, right, all those characteristics in the DSM, right, that tell us that a woman is experiencing a major depressive episode. Okay? She will tell us in her language. Women will describe their exhaustion, their fatigue, their lethargy. They'll say everything is an effort. They'll talk about their confusion, their disorientation by saying, I can't decide. I can't make the simplest decisions. I mean, I'm sure you find that, Emily, that women will say, I can't decide whether I should, I mean, it's as simple as I can't decide whether I should have cottage cheese for breakfast or yogurt. Okay? I can't decide whether I should take a shower first, right, or whether I should go answer a phone message. I mean, it breaks down to those kinds of basics. Women will talk about their mood lability. Right? Another symptom of a depressive episode. They'll talk about it by saying, I feel like I'm on an emotional roller coaster. My moods are up and down. One minute I feel great, the next minute I feel terrified. And that's one of the things that I think is so kind of almost poignant about a woman who's experiencing a postpartum depression. And that is from one moment to the next, she's really not sure how she's going to be feeling. So while she may not be able to get out of bed in the morning because she's paralyzed with anxiety, by the time, 11 or 12 comes around, she's kind of regained her composure. And then at 4 o'clock in the afternoon, when, the bewitching hour comes, as we say, with newborns and with infants, once again, she starts to feel enveloped by that anxiety, or she's afraid to go to bed because she's afraid she'll have nightmares. And so throughout the day, moods are changing, they're shifting, levels of anxiety are changing, and it's very unpredictable. And it gets scary, And even for those women who are moving into a period of recovery, and I know those of us who treat in this field know this, and we experience this with our clients, with our patients, that they will say, I'm afraid it's going to happen all over again. And that kind of timidness and tentativeness, that I'm vulnerable. I'm eternally vulnerable to this, always. Women will talk about their suicidal thoughts. They'll say, sometimes I think everyone would be better off without me. And, my experience has been, and I know all of us usually check out suicidal thinking. We want to know if somebody has a plan, a timetable, a means. Many times when I will ask a woman, what she's thinking, is she feeling as though she might harm herself? Many times what women will say is, no, I don't think I'd do that, but, living in the land of earthquakes, if an earthquake came and a pile of rubble, fell on me and killed me, I think I'd be okay with that. If I walked across the street and a car ran into me, that would be okay. And I think what women are really trying to tell us is how trapped they feel. And motherhood is the one place where you can't just say, I'm done. I mean, I guess you could, but it's not the kind of mother that we want to be. And so, if you don't like a job, you can leave. If you are in a relationship that isn't working for you, it might be hard, but you can break up. But how do you do that when you're a mom? How do you just kind of walk away? Even though we know that many women with postpartum depression feel like they'd like to get into a car and keep driving and driving and driving to some place where nobody will find them. But that feeling of, I am trapped here, Woman in my office yesterday, I have 4 kids. It's going to be like this for the rest of my life. I mean, it's like you can't see the light at the end of the tunnel. I think one of the other things that's really important is what we will see. Let me throw it out to you for a moment and ask you, are there any other things that you hear women say when they're talking about their symptoms? Maybe things that I haven't yet mentioned, or...
Just wondering when it's going to get better. Just terrified that it's never going to end.
Yeah. I've also found with women with postpartum depression that very often they'll feel as though their baby doesn't like them. And I think the worst thing that can happen to a new mom with depression or with not having depression is for the baby to be crying and a family member to say, "Here, let me take her," and the baby quiets down immediately, right? it's one of the most heartbreaking things that can happen to a new mom, because there are two ways in which new moms actually tell themselves that they are good moms. One of those ways is in our ability to soothe a crying baby. If we can soothe our crying baby, right, there's no sense we own that, well, maybe sometimes a baby's just crying because a baby is just crying, and it's not our fault, and it's not our responsibility, and we're not to blame. But when we can't soothe a crying baby, the sense is, oh, I'm a bad mom. And the other way in which moms tell themselves that they're good moms is in their ability to provide the most basic of nourishment, and that is to breastfeed. And even for those moms who choose not to breastfeed, very often there's a sense of failure, a sense of shame, because, these days, breastfeeding is considered something that all moms want to strive for. American Academy of Pediatrics tells us it's something we should be doing. We know it's good for our babies. So even when we decide maybe we're not going to breastfeed, or maybe we're on medication that prohibits us from breastfeeding, right? There's a sense of shame, there's a sense of embarrassment. And breastfeeding has kind of become one of those universal topics. I don't know whether you've experienced this, but I know when I talk to couples, the first question that gets asked is, oh, you're pregnant, when are you due? The second question that gets asked is, are you breastfeeding? From strangers, in the street, I find it really amazing, and I'll hear this from moms and from couples all the time. I think it's rather a private question, between a mom and herself, her body and her baby and herself. So there are things that I think are important to look for, not only to listen for in terms of how women talk to us, but also to look for, because we will see warning signs in the mom, and we will see them in the baby. In the mom, we'll see things like unable to get to appointments, okay? Missing appointments, calling up, canceling, not able to get there. We'll see things like looking unusually tired, or on the other side, looking very well put together. Okay? I don't know about you, but when my kids are grown now, my daughter just turned 18. We're all talking about our kids. I can't quite believe it, but I never got out of my sweats, okay, for weeks on end. Okay? So when I see a mom who comes to the office, with high heels on and all made up and, wearing her best suit, I'm thinking, what's this about?